All right, a very good morning to you. How are you doing? I hope that you're well, you are happy. Thank you so much for being here. I'm so excited to have you on board. This is MBCI TV, where we transform lives by the grace of God. And of course, the show on air is the one and only AFYA CLINIC, where we talk about everything health. And today we're going to have an amazing discussion. My name is Rachel Kahogo. As I said before, is that I'm very happy and blessed to be here with you, to be talking about these very intriguing and very specific topic that I'll be introducing in a very short while. Lakini karibu sana, karibu sana. It's on the 23rd of April 2025. Imagine it's 23rd already. Just the other day we were talking about, oh, it's just 5th. It's the 1st of April. We are here. It's April now. It's already 23rd, which tells you that time is really flying. And I know you haven't been talking about New Year's resolution for quite some time, but this is where I just remind you that I hope that you're working towards your New Year's resolutions. While you started in January, we said that, you know, there's this and this and this that I want to do. Alafu najua nafikanga mahali, unasema, let me just try next year. We said this year we're not saying that. We are working towards it. Hata kama it's a very small step per day, just make sure that you're doing that. All right? And every morning we say that the fact that God has given you another chance to be here, it means that he has a great plan with you. Yeah? There's a man of God, and I'll just throw it in now as we start. There's a man of God, Apostle Joshua Selman, who said that as long as you're breathing, do not underestimate what God can do. Yeah? He can do great things. So as long as you're breathing, as long as you're watching us today and you're here, it means that God has given you another chance to rewrite and to write your destiny. So you have the opportunity to do that. All right? Perfect. Thank you so much for being here. Once again, my name is Rachel Kahogo. I'm so excited to be here. And of course, this is AFYA CLINIC. Our numbers are very open and they're ready to hear from you. We want to know how you have been from Wednesday. It's now yet another Wednesday. It's been a whole week since the last time tulikuwa hapa on AFYA CLINIC. So we want to know how you've been, how your week has been so far, what you're thanking God for. And of course, our numbers are very open for that. That is 0721-105-105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and of course on all social media pages. Ukitafuta Rachel Kahogo, I'll be able to get your feedback. Once again, karibu sana, and thank you so much for being here. We do value your time greatly. Today we are talking about cleft lip. Yeah, and I know that would be a very new word to some of us, so we'll be explaining about what that is. And today with us in studio we have the best people to talk about this, because we have someone when you alisikia cleft lip for the first time and he was wondering what's going on, what is this, and probably that's you right now. Ama you just discovered that your kid has cleft lip and you're wondering what just happened, ama what is this, ama how do we treat this, is there hope? So we have someone who will be talking to us about that, and that is Baba Shine. And Shine is doing very well right now. You told us she's doing very well. Perfect. She's doing very well right now. She had cleft lip, and you have the dad who will be telling us about it, and he'll be taking us through. And of course, because you say that you have to have a professional who will be telling us about the same, we have a nurse ambaye anaitwa Ray. Yeah, you know the people who call me Ray as a short form for Rachel. So maybe we'd just decide nani atatumia Ray, nani atatumia Rachel, nani atatumia Raymond. Karibuni sana.
Asante.
We're very happy to have you on set today.
Thank you.
And just to discuss this particular topic, cleft lip, that some of the people labda ndo wanaisikia for the first time and they're wondering what is that. Yeah, but before we get there, maybe just we'd get into the introduction. Start with you, please introduce yourself. That's your camera.
Okay, thank you. Thank you for having us.
Asante.
I'm Raymond Rotich, but people call me Ray. But sasa mtafu kunita Ray because amesema tunaitana Ray. I am a theatre nurse at Evans Sunrise Medical Center hapa Nakuru, and we've partnered with Cleft Smile Train, which is an international organization. We deal with cleft lips and palates, and I am born again, and I am also a father of 2 kids. Karibuni sana.
Thank you. Asante sana. Okay. Thank you for being here.
Thank you.
Please introduce yourself.
My name is Brian Omondi, Baba Shine.
Yeah.
And also I have a wife, Mama Shine. She, unfortunately, she couldn't have come.
Yeah.
And that's that.
Asante. Thank you for being here. And Shine she is a testimony
Yes.
of people who've gone through the surgery at Cleft lip, and she's now fine.
Definitely.
And we can't wait to hear the story and just to walk through the journey with you today. Asante for being here.
Thank you.
Now, in layman's language, Ray,
Yes.
what is cleft lip?
Okay, cleft lip is an opening in the upper side of the lip. It's normally in 3 phases. There is one side, which we normally call bilateral, and then there is both sides. Actually, one side is unilateral, and then both sides is bilateral, and then it can be in the middle, which we call it straight line.
Okay.
Yes, the opening can extend to the nose. Yes,
Okay.
and then cleft palate is an opening of the palate. That is what we call the roof of the mouth. Like ile ukiweka ulimi unasikia uko juu.
Yeah.
So any child or any adult who didn't get to be repaired, akiweka ulimi, he or she can feel there is an opening. And each time, if you have a palate, they feed. When you feed your child, you will tend to have the spilling of food, whether it's milk or kama anakula mchele or something, inatoke kwa mapua, and they tend to sneeze. And for a palate, it affects hearing and speech, if untreated.
Okay.
Yes.
For the
For the palate. Cleft lip, it doesn't affect anything because unless it extends to the nose.
Okay.
Yes.
Okay.
Yeah.
Now, we'll come to the palate
Yes.
as well.
Okay.
But let's just talk about the cleft lip,
Okay.
vizuri, so that people would understand.
Okay.
I know the people who've seen what wenye, you said it's usually mostly on the
Mostly
upper
on
lip.
the upper lip.
Okay.
Yes.
So ini watu wenye wanakanga ni kama lip
Imepasuka.
imepasuka.
Yes, so tunaita mdomo imepasuka kwa Kiswahili. Yeah, so huwa imepasuka na juu on the upper lip.
Okay.
So inaweza kuwa side moja, that is unilateral, ama inaweza kuwa both sides. Yeah, this right and left.
Okay.
Or inaweza kuwa straight line, katikati.
Okay.
Yes.
I hear you.
Yes.
Now, for us just to understand it better,
Yes.
we have a segment, maybe our director can just confirm that to me. We have the In History segment, where we get to just learn even better about the cleft lip.
Okay.
Now, for us to have pictures and for you to just see exactly what that looks like, we'll be getting the In History segment, where we'll be getting to see the history about the cleft lip. And then as we come back, we'll be coming back to answer any other question that you would be having about the same. All right, and for that, our number is very open. That is 0721 105 105 on WhatsApp, and of course 23814, our SMS code, which is absolutely free of charge. All right, we are live on Facebook on MBCI TV. We're live on YouTube on MBCI TV official YouTube page. So as we come back, we'll be coming back to read your feedback. We'll be coming back to read your questions. So we are ready to hear from you. But for now, let's get the In History segments.
Cleft lip is a condition that has existed for thousands of years, where a baby is born with a split or opening in the upper lip. This condition has been found in ancient human remains from different parts of the world, such as Asia and the Americas. In the past, people didn't understand what caused cleft lips, and in many cultures, they were surrounded by myths and superstitions. Some believed it was a sign of bad luck or a punishment from the gods, and despite these beliefs, there is evidence that some people with cleft lips survived into adulthood, which shows that even early societies tried to care for them in some way. The first recorded surgery to fix a cleft lip was done in ancient China around the year 390 CE. A Chinese doctor named Yu Si successfully performed surgery on a young boy who later became successful in life. During medieval times in Europe, however, surgeries were rare and often dangerous. Medical knowledge was still developing, and only a few doctors or Ababa surgeons attempted to treat cleft lips. As medical science improved during the 18th and 19th centuries, more surgeries were performed. Though early techniques weren't perfect, they laid the foundation for the safer and more effective surgeries we have today. In modern times, cleft lip treatment has become highly advanced and much safer. Surgeons usually repair the cleft within the first few months of a baby's life, helping the child to eat, speak, and grow normally. These surgeries are now part of a larger care plan that includes speech therapy, dental care, and emotional support. Thanks to improvements in anesthesia, surgical tools, and recovery methods, outcomes have improved greatly. Organizations around the world also work to improve free cleft lip surgeries to children in countries where medical care is hard to access. This progress means that children born with cleft lips today have a much better chance at living healthy and confident lives.
Alright, so that is what cleft lip looks like, and I know that after you've seen the images, now you are able to relate and just see what that looks like. And you've heard about the treatment, and now that tells you that treatment is now at a very high level. Yani tumeendelea vizuri, and I thank the Lord for that, because we have testimonies of people who have had cleft lip, and right now you wouldn't even know. They have beautiful smiles. All right, so karibu sana once again. If you're just joining us, this is MBCI TV, and of course this is AFYA Clinic. Today we are talking about cleft lip, and Doc, you've taken us through it kidogo.
Yes.
So now that we've seen the photos, and now we have a picture of what cleft lip looks like, how does it occur?
Cleft lip occurs within 13 weeks of pregnancy.
Okay.
And we've never really known the cause of cleft lip, but scientists have narrowed it to genetics, combination of genes from both parents.
Okay.
And then there are risk factors pia zenye zina affect.
Okay.
Sana sana if the mother smokes or drinks alcohol, and then there is malnutrition pia. Because if you notice, most of these clients, these patients, these babies, they come from mostly from malnourished parents.
Okay. So what
not well to do, not well to do families or backgrounds, and then there is exposure pia to harmful agents, let's say pesticides. Okay. And then yeah.
Okay. Well, you talk about malnourished.
Yes.
What does that really mean? What's the ideal diet?
The ideal diet is balanced diet. Yes.
Okay.
Actually, you just have to have proteins in your system. If you're pregnant, carbohydrates and all the nutrients that you need. Yes. Yeah.
So it's not the high end.
No.
Yeah, I think it's very important to clarify that. It's not the high end. It's what you can afford. What you can afford,
bora it's balanced.
Yeah.
Yes.
Okay. That's very important.
Yeah, but there are some things anyway that we say you cannot control. Like genetically, if your genes, like from both parents, you see that you can't control. Because now it's already something happening.
Yeah.
Yes.
Okay.
And then there is some pollutants, air pollution. You see, maybe the pesticides and all that you're exposed to. So you can't control that. It's already happening.
Yeah.
Yes. And once it's happened, it's happened.
Yeah.
Yes.
Okay.
Yeah.
Now, on the risk factors.
Yes.
As you said, kuna vitu kama genetics that really we don't have control over.
Exactly.
But is there something that you can do apart from just eating well? What are some of the things that you do just to make sure that you have a healthy baby in general, but also avoid cleft lip?
One, I can say the one thing that you can do is do a balanced diet. Once you just know you're pregnant, do a balanced diet. And then there is this folic acid. The mothers are advised once they go to the clinic. So once you know you're pregnant, you are advised to go to the clinic. Then you'll just be monitored from there.
Okay.
And then they will be doing some scans, like the ultrasounds. You see from the onset, you've noticed, you've realized you're pregnant. So unafanya ile kupima kuangalia mtoto yunaendeleaje. But you see, the ultrasound, you can do an ultrasound or a scan if you're pregnant. But from 18 weeks to 20 weeks, then you'll note if your baby has a cleft lip. That can be noted from 18 weeks onwards, but not less than that.
And would you do anything realize on a cleft lip at like 18 or 20 weeks?
You can do nothing, so you'll just be prepared psychologically. Yes. So you won't have that fear, like sasa, my friend Brian aliambiwa kwamba sasa kuna issue kidogo. So he was like, aish, sasa hii mambo gani? So if you do that scan, sasa unajua. So he would have been prepared, like akienda sasa kuambiwa mtoto ndiye anasaliwa, he knows. So already atakuwa amefanya research kwamba akisaliwa what do we do, step by step to akisaliwa tunaenda wapi, and then next. So you see, psychologically you're prepared. Yes. Okay, I hear you. Yeah.
Brian, Baba Shine. First of all, mbona Shine? You know, you've just explained that, so I'll just blow the bubble. You've already explained that, but I feel like that's really beautiful. I've never had someone with the name Shine, you know, surely. Yeah, why Shine?
When we knew her mother was expectant, it really brought light to us. So we decided we shall call her Shine. Yes. Okay.
How old is she?
Right now, by July, she will be turning 3 years. Yes.
Okay. Now, how did you know that your baby has cleft lip?
After she was delivered, now, when going to see her, the doctor now said, and she has a small issue. Unashanga. That to me now is a big issue. Yes. I felt weak, trying to understand what could be the issue. But after seeing her now, I understood what was the issue. Was the issue?
Okay.
Yes.
At first, when you saw her, did you know that any cleft lip? Was it the first time you were seeing it or hearing the word?
Yeah. First, I knew it was a cleft lip, but I didn't know the extent of the damage. Maybe it was the palate. Because me knowing a cleft lip, it is the whole thing up to the palate. But after she was examined now to understand it was the lip. To me now that made me feel at least
tuko sawa.
Tuko sawa.
Okay.
Yeah.
Now, you know, as a parent, you get to realize that your baby has a cleft lip, and the first question is usually, na atakuwa sawa? Yeah. So what was your first action after you now knew akona cleft lip, na si palate, ni lip too? What did you do at first?
At first, I have a friend as a doctor. She was the one. He is the one who said this is a small issue, is the lip, and it is repairable. And to his knowledge, he knows the hospital where it is done. So he's the one who referred me to Evans Hospital. Yeah.
I hear you. Now, Doc, when you first see a baby who has a cleft lip, what is usually the first, what is the intervention? Kuna treatment, apewe tu dawa and you're like, well, see, after 1 month utakuwa sawa, you know?
No. When we receive a baby, let's say a baby, we're doing Shine. So when Shine comes, we do the physical checkup. So once we know she's clinically okay, and she came at 3 weeks. It was 3 weeks. So they brought her at 3 weeks. So we noted she was healthy. So we advised them, that is what we do once we know the baby is okay. So we advised them on how to feed, because feeding such babies is not like the normal babies. So we advise them on how to feed her, the suckling and all that.
Yeah.
Our nutritionist normally handles that.
Okay.
Yeah, so we advise them on the feeding because we want that baby to have the kilos that we require for the surgery to be done, which we normally, for cleft lips, we normally do the surgeries at 3 months with the kilos of 5. So akifikisha kilo 5 na akona miezi 3 anakuja hospitali, we just do the preliminaries and all that. We just take the blood samples, we just confirm the kilos, and once we know they're okay, we proceed to surgery. Okay. So the intervention, the first things, we just observe the babies, and then we advise them, kama wajafika miezi, we just tell the parents, you just go with your baby home, just nyonyesha venye umeonyeshwa, akifikisha miezi 3, kilo kuja nayo tupime tena, kama ako sawa, we book them for surgeries. We normally book them like today. So when we speak, we booking babies tomorrow for surgeries on Friday at even sunrise. So we book them like today, we operate on them the following day.
Why?
Yeah. We have to observe the babies overnight.
All right.
We cannot just book them and go direct to surgery. No, that is the procedure. We book them, we admit for an overnight observation with the team, our nurses and our doctors. And then the following morning, we just go in, we operate, and then we discharge them the following day.
All right.
Yes.
I hear you. Yeah. Why 5 kgs?
Under 5 kgs, it's not recommended from the smile train. That is the rate at which we need to have surgeries for cleft lips specifically. Because most of the time, if you do at under 5 kgs, you'll find the babies undergoing anesthesia is more at risk than when they're 5 and above kilos. That is normally for the anesthesia. Yes.
All right.
Yeah.
I hear you. Now for the cleft palate.
Yes.
Maybe for the people who've just joined us, you can explain to us once again what cleft palate is.
All right. So cleft palate is an opening on the roof. Ile ukiweka ulimi, let me just put it in layman's language so that people will understand. Like ukiweka ulimi juu ya mdomo yako unasikia kuna ile ukuta. So for a cleft palate, that roof has an opening which may extend. Normally it extends to the nose because once that roof is opened, the nose is exposed. Yes. So that's that is a cleft lip which extends to the nose. So this one, the first one is unilateral because you see it's on the one side, that is on the left side. And the second one is bilateral, which is on both sides. And that definitely has extended. The first one, if you note, you'll see it extended to the nose. Even the second one to the nose. Yes.
So this is the cleft lip?
This is a cleft lip and a palate. If you notice, yes.
It's both.
But we normally start with the lip. Yeah.
I hear you. Now, that's the question we're going to next.
For
the cleft lip, does it always extend to the cleft palate?
No.
And will it be then a risk factor to come up to a cleft lip? Would they then have a cleft palate?
Not necessarily. Most cleft lips are just the opening on the lip. But if you see, most of the bilaterals extends to the palate. Yes. But let's give it like 60% of the cleft lips extends to the palate. That is unilateral. But bilateral, most of the time, let's say 90% extends to the nose, to the palate. Yes.
Is the treatment the same?
Not the same. We normally start with the lip. You see, as I said earlier, we do the lip at 3 months. But the palate, we do at 9 months. So we start with the lip, and then we just let the baby go home. We give them time for the muscles of the palate to just become strong. Because you see, we just come to cut it, and then we bring them together.
Okay.
So we need a stronger muscle that will just heal perfectly.
Okay.
So if you do that earlier, it tends to just give way. You see, because it's not as strong as we recommend. That's why we give them 9 months and 10 kilos. And HB, which is hemoglobin level, must be 10 for the palate. You see, because the palate tends to bleed more than the lip.
Okay.
Yes.
All right.
Yeah.
Okay, I hear you. So, Brian.
Yes.
When you realized that your baby has the cleft lip and you took her home for the 3 weeks, did you have any difficulties with maybe feeding the baby? Did you realize that she's any different? Ama mtoto ambaye yuko na cleft lip, she's like the same in terms of feeding and behavioral and everything else as a normal baby?
Funnily enough, Shine was just breastfeeding normally.
Okay.
Because hers was only the lip. It had not affected the palate.
Yeah.
And also the gum. It was not affected. So her was she was just breastfeeding normally.
Okay.
Yeah.
Did she have any pains?
No.
So doc, cleft lip is just cleft lip. No pain.
No.
No nothing.
No, nothing.
It's just your
Actually,
lip is
cleft lip
different.
it's painless.
Yeah.
And it has no issues like the cleft palate.
Okay.
Yeah. So.
Now, for the cleft lip, what are some of the, apart from the fact that you'll see that your lip is a bit different, what are some of the other characteristics of the cleft lip? Will it affect your feeding for a baby?
Yeah. Yeah.
Will it affect anything?
It does if it's bilateral and if it's extending to the nose.
Okay.
You see, for Shine's case, hers was just a lip.
Yeah.
So the gum was perfectly okay. Yeah. So if the baby has the unilateral, which extends the nose, and maybe extends to the palate, it affects feeding because you see, for a baby to suckle, kama nanyonya, there is that ile kushika matiti ndio maziwa itoke. But for these babies, if it has the opening which extends to the nose, she can't or he can't because there is a lot of air escaping. Or anaweza nyonya unafikiri amenyonya but ni hewa tu. There is no that latch. See ile kulatch. Yes.
Okay. Now is there a long-term effect to that?
Not unless repaired.
Okay.
Yeah.
I hear you.
Yeah.
Now, I see that our time is really running and I'll be getting to go through some of the feedbacks that we have. But for now, I'd love for us to get Healthy Living by the one and only Sylvia Wanja that will help us understand, how to continue living healthy because that is very important. So let us get Healthy Living and then we'll be coming right back. But let me just remind you, our numbers are very open. I see questions are already coming through our WhatsApp number, which is 0721 105 105 23814. Our SMS code, which is absolutely free of charge. We are live on Facebook and YouTube. On Facebook, it's MBCI TV, and on YouTube, MBCI TV official YouTube page. So, Healthy Living, and then we'll be coming right back.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we are going to focus on treatment options for cleft lip. Cleft lip treatment involves a team approach and often begins soon after birth. The goal is to improve appearance, speech, feeding, breathing, and emotional well-being. Number 1, we have surgery. That is the main treatment. Timing is very important and it's typically done between 3 to 6 months of age. The procedure involves a plastic surgeon carefully closing the split lip and reshapes the nose if needed. The follow-up after surgeries may be needed as the child grows to improve appearance or function. Number 2, feeding support. Babies with cleft lip may have trouble sucking. Use special nipples or bottles to allow milk to flow more easily. Position the baby upright during feeding to prevent choking or nasal regurgitation. Number 3, speech therapy. Some children may develop speech problems, especially if cleft palate is also involved. A speech language therapist helps with articulation and language development.
Number 4, dental and orthodontic care. Teeth may be misaligned or missing. Pediatric dentist and orthodontist manage tooth development and alignment. Braces may be needed later in childhood. Number 5, psychological and emotional support. Children with cleft lip may face teasing or self-esteem issues. Counseling and support groups help boost confidence and social skills. Number 6, multidisciplinary cleft care team. Treatment often involves a team of specialists, that is a plastic surgeon, pediatrician, ENT doctor, that is ear, nose and throat, speech therapist, dentist or orthodontist, nutritionist, psychologist or social worker. Long-term follow-up. Ongoing checkups are needed throughout childhood. Additional procedures may be required as the face and teeth develop. In conclusion, the cleft lip is treatable and most children go on to live healthy, active and confident lives with proper care. Early diagnosis and a team of caring professionals make all the difference.
All right, we are back, and you've heard from Sylvia Wanja what you can do, and I've absolutely loved how she's explained how the shape can be, the nose can be reshaped and how you go through all that. And, it's a good news that everything is really possible. So if you have a baby who has cleft lip, this is good news to you that it can be solved. And we have Baba Shahid as a living testimony for us today that, Imaneno, you're able to take care of it. It's not very extremely complicated. All right. Now we'll be getting some of the vox pops just to get to understand what people know about cleft lip and what you'd say about cleft lip. All right. But before we do that, let's talk about the emotional support that children or parents who have children with cleft lip would need. And maybe these would go to you, Baba Shahid. Have you ever needed? Have you ever needed a support group, a space where you can talk about what your baby was going through, or was it just life as normal for you?
No, I have had support from my parents, from her parents also, and also friends. They really came through, the doctors, especially my doc here.
Yeah.
That period, he would also call. How is she doing? How is her breastfeeding?
Yeah.
He used to follow up.
Okay.
So that moment when it came, we were not even told bado hajafika kilo nini. She just went to the surgery.
Yeah.
And it was a complete success. Yes.
Amazing.
Yes.
And I can just imagine how good that feels when you see a baby moving from one milestone to the other in terms of treatment.
Yes,
yeah.
yes.
Maybe as a doc, from your perspective, what would the community do better just to make sure that the parents who have kids with cleft lip feel more included and they feel more comfortable to even talk about the same?
Thank you. You see, most of these parents there is that's stigmatization.
Yeah.
So wanaogopa ku come out because of the baby. Wanaona like it's something it's never happened. So if the community wangewa encourage, if our viewers wakiwa wanaangalia sisi, they can talk to the parents. If they know this parent has this baby na kona issue, it can be repaired. The cleft lip will be repaired, and the baby will live a very normal life. And it's not a disability. We ought to just let our parents who have these babies know that cleft lip or palate is not a disability. Unless it's a long term, and if it's a palate and it's affecting, let's talk about hearing, if it's a lip, or speech. Because most of the time, like if you find an adult who didn't have a repair of a palate, the speech is altered big time. So you see, the people, the community, or the people around that person, that specific person, will find this person a disabled person, because you see, he or she cannot have a conversation, which is audible. Like unaweza sikia, unaweza have a conversation.
Okay.
But if you just bring us that baby, akiwa the 3 months, na hiyo lip, we repair for her. Akiwa 9 months, na hiyo palate, tutatengeneza, ataishi normal life. Yes.
Okay.
Like all that.
You talked about the palate being a bit, it's not complicated, but a bit more complicated and a bit different.
More complicated. Let's say more complicated than the lip, yes.
Yeah, than the lip.
Yeah.
So what are the effects of the lip palate, of the cleft palate? Okay. So mtu mwenye akona the palate, because you mentioned about spillage of food once in a while. What would be the effects of that?
It's uncomfortable to begin with for a child with the palate.
Imagine. Yeah.
You can imagine, like, if that child each time akinyonya, you see masiwa utoka kwa mapua. You just imagine you and magic itoke kwa mapua if you are a normal person.
Yeah.
How uncomfortable is that? Now imagine this is a baby, which is, she or he was just born.
Yeah.
She cannot communicate. You get?
Yeah.
She cannot communicate.
Yeah.
The only thing that she can do is just cry, because each time unajaribu kumnyonyesha, there is that reflux ya masiwa kwa mapua.
Sasa atafikaje kg zenye anafaa kufika?
Yes, exactly. So we normally have our nutritionist, Palliative and Sunrise. They can advise on how you can suckle that baby. And it works.
Okay.
It works.
Okay.
There is also, once amefika, like time for weaning, let's say 6 months now, plus, there is a way you can feed that baby.
Okay.
Not like the normal feeding ya spoon, unampea mtoto food na mkichiko kama imesimama. There is a way you can turn that spoon, then it attend kufunika that palate. Then if that baby amefika ya miezi, anaweza tu beba hiyo food na ulimi wake.
Okay.
So you do that, as we encourage. Plus kuna zile ya machakula tu ya kuongezea kilo. Then akifika that 9 months, and then we say he is 10 kilos. We say thank God.
Yeah.
Wanatuletea mtoto, we just fix the lip at the palate. And from there atakuwa sawa sawa.
Okay.
Yes.
Oh, wow. All right. Now let's get the vox pops so that we get to understand what you would say about the cleft lip.
Pengine huwa inakosiwa na diet, ama pengine wakati mama akiwa mjamzito anatumia dawa zingine ambazo zinaleta hii shida, na pengine jinsi kwa mwili huwa zinaleta hii shida.
Mimi huwa ninafikiria, ama kwa maoni yangu huwa ninasema tu ni ulemavu, ni kama tu vile mtu anaweza tu zaliwa akiwa kiwete. Sasa hata huwa ninasema tu ni ulemavu kama ina hiyo.
I think cleft lip is caused by a genetical condition that is found in the genes of the mother or the father of the child.
Kitu cha kwanza yaweza kuwa labda ni kama tauni ambayo kwa mujibu maandiko ya Mungu huwa ananena ya kwamba watu wa kiasi amri zake ama kosa kumtii atawaachilia maradhi tofauti. Hiyo ni njia ya kwanza. Njia ya pili, yawezekana kuwa labda hiyo shida ama disability kama hiyo imepatikana kwa mujibu labda wa familia, labda ile kutokana ukoo, kuko na labda dhana ya vitu kama hizo, labda hizo shida ndizo zimefanya ipatikane katika mmoja wao kifamilia. Ile variation ile tu tunasoma kwa shule.
All right, so that is it. Doc, maybe what would you say about the vox pops that you've had?
Okay, what I noted from the vox pop, it's like wanaita disability. So nasikia mmoja amesema ni ulemavu, kama umezaliwa, kama utembei. It's not. Let's have that in mind kwamba cleft lip is not a disability.
For sure.
It's never been a disability. That's why I said unless it's long term, which affected speech, kuongea, ama kusikia, which normally occurs due to cleft palate, not lip.
Okay.
Si disability, si ulemavu. Cleft lip, si ulemavu. So let the parents who has a baby or a relative or a friend wajue kwamba si disability. And if you have such baby or a relative or a friend, please tulete even Sunrise Hospital. Let's just fix and bring that smile to that baby. Tafadhali, usiite ulemavu. Kindly.
I absolutely love the fact that you have insisted.
Yes.
That si ulemavu.
No, it's not.
It is not a disability.
No.
And you can absolutely solve that. So, Enda Evans, if you're there and you have a baby who has cleft lip or the palate, mpeleke Evans.
Wanipigie simu.
Ama wakupigie simu.
Yes.
And we'll be sharing the numbers very soon, in a very short while, so that we get to look at that. Now, let's get to see some of the myths that surround cleft lip.
Okay.
Because also, that's something that is really, I wouldn't love to say interesting, but there's so many myths that surround cleft lip.
A lot.
Now, let's get the myth busters so that we just get to see what are some of the myths that surround the cleft lip. All right. So very first myth buster today is that cleft lip is caused by a curse or by bad luck. What, in fact, Obashane, since you're here, please tell us, is that true?
No.
Money story.
Hiyo ni story.
Did you ever maybe think of what's the cause of this when Shane came? Did you think of that?
Yes.
Did bad luck or a curse cross your mind?
No.
Okay.
I just said issue makosa ufanyika. Na hiyo ilikuwa ni makosa, huwezi jua sasa what has happened. We just embraced it na tukasema tutadeal tu nayo vile imekuja. And God help us through. Yes.
Yeah, for sure. It's beautiful. All right. The second mythbuster that I have today is that cleft lip only happens in poor or developing country.
That one I can say yes and no. Because if yes, you see, there was an issue of malnutrition. Malnutrition definitely is poorly developed countries. So there is that trend of the mother not having enough of the balanced diet. Sawa. And so we can say it happens in mostly in poorly developed countries. But you see, in the whole world, out of 700 babies that are born, only one child has either a cleft lip or a palate or both, cleft lip and palate. But in Africa, out of 1,400 childbirths, one baby has a cleft lip or a palate or both. So you see, it's yes or no. Yes.
Because there are other risk factors.
There are other risk factors. So you see, in developed countries, so risk factors in developed countries, you see that pollution, because you see a developed country, most of the time, unapata wako na hiyo air pollution, a lot of it. And then there is this pesticide and these solvents, sijui wanachanganya vitu na nini, so it happens like that. So on poorly developed countries, most of the time is malnutrition. Yes.
I hear you. All right, let's get to take a look on the other mythbuster that you're having today. The third one is that babies with cleft lip can't be fed properly.
No, I tend to disagree with that, because if you have taken your baby to a facility where there is a nutritionist and counselors and all that, that baby can be fed properly. They can be advised on the balanced diet that they can get in their surrounding areas. You see, because kama unatoka maybe not well-to-do place, there are things utaambiwa kuna balanced diet, chakula inakaa, munakuwa na gani na gani, so you can be advised like that. So I tend to disagree with that. Yes.
And maybe in terms of the actual feeding, in terms of can the baby actually even feed properly? Because now you've had we have Shine. Now, maybe just to make it clear on that point again, and to add on what Doc has already said, would you agree with the fact that a baby who has a cleft lip, or a cleft palate for that matter, because I know that you have done the research quickly after you had Shine, would you say that these babies are not able to feed on themselves? Maybe an appetite or something. Are they not able to feed normally?
No, they are able to feed normally. Yeah. When, let's say, it depends with the extent of the damage. But with the help of the mother, she's able to feed properly.
Okay.
Yeah.
Okay, so it's a two-way.
It's a two-way.
Okay. I hear you. Right. Let's get to take a look at the other myth, Pastor. Is that surgery completely fixes everything?
Yes.
So that's not a myth?
No, it fixes everything from the onset.
Okay.
Like if it's a lip, like for Shine, it fixed everything.
Yeah.
If it's a palate, surgery fixes everything because we do the palate, and then if it's something we do dental formula, dental structure, we have dentists. If it's earring, we have the ENT consultant and surgeons.
Yeah.
They can fix that.
Yeah.
Yeah. So I agree with that.
So it fixes.
100%. It does, yes.
Okay. Yeah. So for the people who felt like tutaenda surgery alafu turudi bado tuna struggle. No.
It might go like for a long time, because you see if a baby is born with the bilateral, the one we're talking about, you see it affects even the gums.
Yeah.
Yeah. So once meno ikimea kwa huyo mtoto lazima aonekane na dentist.
Okay.
Pia, and then a follow up. And then baada akishapata meno, and then pia kuna ile akifika 13 years, then we just do the braces to fix.
Okay.
Akae tu kama sisi mimi na wewe.
Yeah.
See, and it tends to work.
Yeah.
It works.
Okay.
Yeah.
Okay. I hear you. Yeah. Now, I see that our time is really running, but we have people who are already asking for the location of events and the numbers, which we'll be sharing just now. But maybe before we do that, maybe you can just give a word to someone who they've just realized that their baby have cleft lip or cleft palate. Just advise them and, you know, give hope. Yeah.
I would like to advise the parents not to feel ashamed, not to feel afraid, and not to keep the babies at home.
Yeah.
Just ask for help, and definitely you will find help. Yeah.
Okay.
Yes.
It's very important.
Yes.
Asante sana, and thank you for being on this show. Thank you for sharing your story, the story of Shine, and you know that has given you know hope for more people and for people who are going through the same. Yes. Right? Asante sana for that. Now, Doc, what would be your parting shot in terms of cleft lip and cleft palate?
I would advise, as we said, cleft lip is repairable.
Yeah.
Cleft palate is repairable. And we do it for free at Even Sunrise with in conjunction. Yeah.
Oh, wow.
With,
okay.
Smile Train. So all you do, let a mtoto, if it's a relative, a friend, or your child, even as an adult, we even do adults, free of charge. Wewe unakuja tu na nguo ya mtoto.
Yeah.
Na wewe kama mzazi unakuja na mtoto. We admit you, we just check the baby if he's okay, fit for surgery, or we book you, or if the baby is underage, we just book you for surgery. Then we just have your contacts. Once tunajua amefika miezi, we call you, we admit you, we do the surgery, then we discharge you, you go home. Then we follow up 2 weeks later tuone kama healing is okay. We do it for free.
All right.
Atulipishi hata shilingi moja.
Oh, nice.
Yes.
Okay.
Karibuni sana.
Anakula?
Immediately after some few moments, she will be breastfeeding.
Immediately?
Yeah.
Oh, wow.
After, let's say, the anesthesia is gone, she will just feed.
That's good news.
Yeah.
That's good news. How about for, I know you've mentioned about the adults, but maybe we can just, you can tell us about it. For the adults who maybe didn't have this kind of information while they were younger, or the parents didn't have this information while they were growing up. You know, they're adults and they have a cleft lip.
Okay.
Is it as easy to correct that? Unlike kama angekuwa mtui.
Yeah, it is. It's normally easy.
Okay.
Because for adult sleeps, it's the easiest actually.
Okay.
Yeah, we can even do it under local anesthesia for the lip.
Okay.
And for the palate, for an adult, we know speech, if it's past, let's say 12 years and above, speech would be a bit difficult, but not as such. But we'll just prepare the palate for the comfortability of the adult to feed and not feel uncomfortable.
Okay.
Get?
Yeah.
Yes.
Okay, I hear you. Now tell us where Sunrise, Even Sunrise is.
Okay, Even Sunrise, if you know Nakuru Athletics Club, is just on the other side. So ukiwa roundabout ya D&D, below, ukiteremka tu chini kidogo, is on your right.
Okay.
Yes.
Okay, perfect. Your numbers for the people who want to call you?
0727 280 876. That's my number. 0739 199 992.
Okay.
Yes, for Airtel. Yeah.
All right. Please just repeat again.
0727 280 876. 0739 199 992.
Okay.
Yes.
That's easy.
Yeah.
That's easy.
Yeah.
Yeah.
Give us a call.
Memorize.
Yeah.
Yeah. All right. Thank you. Thank you for being with us on this first session. And I know that we have all learned something. For the people that this is your very first time that you're hearing about cleft lip or cleft palate, I know that you've been able to just understand what that looks like and you've gotten something from the discussion. So asanteni sana for being here. We do value your time greatly. We are not done yet. So we'll be taking a very short break. We're done with the first part. Now we will be coming back. As we come back, we'll be talking about something totally different. We'll be talking about KRA. Yeah, that's what I've said, is something totally different. Now, we're done with the actual AFYA clinic, where we talk about everything health. But as we come back, we realize that it's also very important for us to talk what you're supposed to do, you know, just as a person. So we'll be talking about KRA, we'll be talking about filing taxes, we'll be talking about all that. But we're taking a very short break so that you would just digest the conversation that you've had, you just think about it, all right? And that would be very important. Others, asanteni sana for being here, and I know that you've gotten something. As you always say, is that we do value your time greatly. Usiene mbali, we'll be back after a very short while. Asanteni sana once again. Yeah.
MBCI Television.